Hi, welcome to my webpage, Rope In Mental Health. I was asked recently, why is it that I do this? Like, what is my purpose? What am I gaining from this? Well, this all started a long time ago when I first got a taste of occupational health and safety. Well, I was a safety guy for a small residential company in southern Alberta. We built maybe 600 homes a year in 3 different cities, and all the guys and all the work that went into putting into the safety program, I really got invested. And I found myself bringing home a lot of stress of other people. I found a lot of what I now know is called caregiver strain. And from talking to my other safety guy buddies, there's just a really big problem of managing stress in the workplace. We know this. This is like the big awareness campaign that everybody else has been doing. And now that we've done the awareness, it's time to move on the conversation to what is a solution. Now, I propose the solution is actually teaching mental resiliency in the workforce. And this is a way of appeasing that original goal I had of bringing a little bit of peace of mind to my colleagues, my friends, my loved ones, people I care about, myself included. Mental health touches so many people in this world, and these are really simple skills. Basically what we're looking at is problem solving skills, 4 basic types, right? And we're looking at emotional regulation and emotional sensitivity. Now, that's my specialty. That's what I deal with is the emotional support and systems to maintain the mental health area. And then there's the social health side of things. The other 3 items would be like a support network for yourself, a community involvement, and just that strong in the workplace. We're talking about corporate culture. Anyway, corporate culture has been a thing that's been around for a long time. So why am I doing this though? Ultimately, it is to help the workforce, to help myself, my friends, my family, my children. I've got 7 children between myself and my lovely wife, Becky. We have 7 children who are entering the workforce. Amongst many other things to scare the hell out of a parent. Now you've got your kids going into industries that you know are not safe and you know are full of addictions and mental health issues like bullying and mobbing and all of the social and emotional mental health well-being things that are going on in Canadian workplaces. It's frustrating, actually, from a safety guy perspective. Now, mind you, I mentioned that I did safety for residential construction. Now, you want to talk about something that is frustrating. That's trying to convince a bunch of guys who are numbered companies on residential sites that they should wear a hard hat or use a ramp. Maybe your knees and your back would feel better if you just built a ramp instead of lifting things up and down anyway. It's like herding cats. It really is. Trying to do safety for mental health is another strange phenomenon. Now, fortunately, the world is on my side. Fortunately, for the last while, the World Health Organization, as those of us involved with mental health know, the World Health Organization, as well as all of the health regions across Canada, are doing a great job of awareness and a fantastic job of collecting all of the research and data you could want to look up on how workplace stress affects you. And the problem now we face is that we're getting stuck in that loop of problem solving. There's only 4 steps to problem solving, right? Identify the problem, figure out ownership, and then you got to propose a solution, right? That's where most companies get stuck in their safety plans. But anyway, that's another whole discussion. And then, so you identify the problem, you pick a solution, right? Just pick a solution and put it in action. Put it in action is obviously the third step, and then evaluate how well it did, right? So you've got to realize that there's a problem. You've got to observe everything about that problem, gain your information. You got to propose a solution, and then you've got to evaluate its effectiveness. ROPE. There's that acronym I keep going back to again. Anyway, you've got to rope in that mental health in that acronym's meaning. Really, we're getting stuck in the problem phase. We're getting stuck in identifying the problem over and over because it's fun. Everybody likes to complain about stress. Everybody loves to. And the great thing about that is it is one of the skills that you can use to actually lower your stress, is express that stress. However, in a helpful and useful manner, that can be helpful. Right now, what we're doing as a community is we're just reiterating to each other how bad it is. And we're saying this is another problem, and this is another problem, and this is another problem. And all of a sudden, we get into the same situation that residential construction and safety was in, was that the problem's so vast, nobody really knows why. Like, why? What do we do? Like, we've discussed this to death, and now we need a solution. Well, I'm proposing one. And it's not even my solution. It's been around for a long time. I'm not trying to really create the wheel. Mental resiliency has been used in the educational system for a long time. I worked for a company, a really good company up in Calgary, Woods Homes. Shout out to them. They do great work with young people and youth who are trying to struggle with emotions. They've been around for 100 years, and they've been teaching mental resiliency. Educational systems that I grew up in North Delta over in BC there. I was the benefactor of some of these resiliency programs. I do struggle with attention deficit disorder, and that is a daily problem for me. And there's a lot of things that go along with that, but you learn, you cope, you become resilient. And fortunately, I had this training all the way through school. So now that I've been a registered nurse in mental health, I've been an occupational safety manager for a long time and mentored other safety companies in evolving their safety, I'm turning my eyes to occupational health. And as a mental health consultant, what I can do and what I offer is a way of coming into your business, working with your staff, working with yourself if it's a personal matter. If you're struggling with stress and if you're struggling with making those healthy changes in your community, in your life, in your place of work, I can help. I can guide the process. Personally, I'll come in and I will advise, train, and support you and your team through whatever changes you want to do. While you're doing that, the benefit is you will grow a stronger bond, and the language of the program we develop together is going to be one that your company and you yourself truly believe in, and you know that the changes that you're proposing at that point are the ones that are leading towards the goal you set for yourself. And that's what I do as a mental health consultant. I try to guide you through the process of healthy life changes. Now, why am I different than any other safety guy out there? Well, I deal with the emotional burden. There's emotional regulation and emotional sensitivity. Emotional regulation, that's a really complicated way of just saying, what do you do when you get upset? Okay, if you hit somebody, if you get really silent, if you storm out of the room, if you have another cigarette, if you do whatever it is you do that you do or don't like, that's your emotional regulation. That whole process involved with not reaching for a cigarette, but reaching for a piece of gum. You know, anything from implementing a new strategy. If you've been doing work the same way for 20 years and now there's a new tool, a new invention, a new whatever that comes out that changes your policy, if your workforce is struggling with that, attacking it at an emotional level will actually attend to their motivation, and you can even bypass worker buy-in, because at that point everybody will be just working towards one united SMART goal. And SMART's an acronym, but you can take my training to figure that out. I'm just joking. Do a YouTube search on SMART goal setting. You know, if you're not doing some of these really easy, simple steps in your program, if you're not clearly wording things in the language of your workplace, if you're making safety programs just to have a certificate hanging on the wall, you know, there's an easier way to go about it. There's a much easier way. It's through building mental resiliency training. It will help with everything from safety programs to productivity to quality assurance, quality of life of workers and worker satisfaction. All of these things can be built up through building their mental resiliency, which primarily I focus on a recreation-based style. Play-based learning, if people are familiar with that. It keeps people in that emotionally calm, fun-loving sense where, you know, remember back to high school science where something exciting happened in the class and all of a sudden you paid attention, but you remember that, right? So we use that. And in education, oftentimes the comment of they won't remember what you said, but they'll remember how you made them feel is so true. So harnessing all that we know of biology and psychology, we can work together to build your mental resiliency, your family's mental resiliency, your community's mental resiliency. I want to forward the conversation on that. Of course, I want to sell myself as a consultant. I'm more than willing to help out in that way if our styles mesh and you think that I'm going to help your workplace. If not, find somebody else out there. Most of the health regions will do mental resiliency training. They might even do it for free. I don't know. And if you want a PowerPoint, pen and paper, grind of a lecture style course, I'm sure there's lots of things out there that can help you understand these concepts. I hope you like the way I do things, and I hope you check out my channel again. I'm just trying to forward the conversation on mental resiliency training. I think it really is the answer to this health crisis that is stress. Anyway, thank you for listening. I hope you enjoy your day. Find some time to have some fun. Tell your loved ones you love them. Okay, you guys have yourselves a great day.